So I'd like to welcome everyone to this Stats Café webinar on applying indirect demographic techniques for CRVS inequality assessments. This is also our third and final event in a wider series of webinars and expert group meetings on inequality assessments under the title Inequalities in CRVS. Let's really get everyone in the picture. My name is Petra Nachmias, and I'm Chief of the Population and Social Statistics section at ESCAP, based here in Bangkok, and I'll be moderating this webinar. Just a couple of housekeeping items. We do request that if you're not a panelist, that you please keep your camera off and your microphone on mute. We will be muting people who might inadvertently leave their microphone on, so apologies for that, but it's important to reduce the background noise. This webinar is also being recorded, and we will make the recording and presentations available on the website. If you have any questions or comments, we would invite you, for the sake of efficiency, to please write them in the chat function, which we will be monitoring throughout the webinar. So we're really delighted to see such a large number of participants in this webinar, and I think the importance of inequality assessments for CRVS is clear. And given the importance of civil registration and inclusion in vital statistics, it becomes even more imperative that people are included, and the people who are excluded from civil registration, they're not only left behind, but they're not even visible. And since those who are left out tend to be the most marginalized and vulnerable, this exclusion just compounds their marginalization and vulnerability. And if we can't measure it, we can't know exactly who these people are, which would then hinder any policies to target their inclusion. And also, if we can't measure it, then we also can't see if those policies are working and if any progress is being made. And this is really what makes these issues of inequality assessments so very hard. And one key metric in the level is for inequality assessments is the level of completeness of vital events, of the registration of vital events among subpopulations. But we need to be able to estimate the numbers of these vital events among these populations in order to assess the completeness. And this can be very challenging to do for the very reasons that these people are being excluded. Therefore, in this webinar, we're going to be looking at a number of indirect methods to estimate births and deaths and to measure completeness, and look at how they were applied in countries with very different registration and data systems and contexts. We're very lucky in this webinar to have with us an outstanding panel of presenters and discussants who are doing some groundbreaking research in this area. I know we could speak on these topics for hours, but we're limited by time in this webinar. Therefore, I ask the speakers and discussants to kindly stick to the time constraints and for participants to add any questions into the chat function. I will remind everyone that this webinar is going to be followed by a half-day expert group meeting later this week. So we're going to have ample time to expand on any issues which are raised here. So we will continue the conversation. So without further ado, I'd like to move to our first presentation. This will be presented by Thomas Thornburg, who is a Population Affairs Officer at the United Nations Population Division in the excellent but underrated team responsible for the UN's population estimates and projections. And he will be looking at his team's experience estimating births in various countries in our region. And I would like to extend our particular appreciation to Thomas, for whom this is the middle of the night in New York. So thank you, Thomas, and over to you.
Thank you. Hello, everyone. Let me just pull up the presentation. Here we go. So the brief talk I will give you is like an overview based on our practice on related with the World Population Prospect. So the World Population Prospect, quickly, is a reconstruction of population by age and sex for all the countries of the world from 1950 up to 2020, and then we project till 2100. And when we reconstruct the population, we use all available data. That is the population by age and sex, so mortality, fertility, and migration, and all of that by age also and sex. And we use the cohort component method. So in our work, we use different methods to apply. We apply different methods to validate the quality of birth registration. And we will go quickly through four main that we use. And the idea is that to have as many independent estimates to assess the quality of the birth registration. So the first one is based on the population reconstruction, that we will compare the reconstructed number of births with the registered births from the vital registration. The second one is simply a direct comparison from what comes out of the census and what comes out from the vital registration system. Another one is based on population count by age and sex, that is either drawn from a census or from different counts, and we will see here an example with the school records. And finally, we will see quickly a comparison with immunization records for infants, So the main idea is that we cross-validate as many independent estimate as possible, and from that we can derive a kind of consistency. So the population reconstruction, the first method, and that's what we do in our section. Usually we take one baseline population, can be the previous census, and we apply the component for population change, that is, we apply mortality, fertility, and migration, and reconstruct the population from the previous census up to the present date, and we compare what comes out. The advantage is that it's a very powerful method to validate any data, and it returns consistent population data and demographic indicator by age, sex, and cohort. A limitation is that it's heavy in terms of data requirement. We need detailed population by age and sex, a life table, fertility rate, migration by age and sex. Here is a quick comparison. On the graphic, we have the orange series, which is the reconstructed birth from Myanmar. On the left side, you have all the series that have been used to reconstruct the population and the birth from Myanmar. And we can compare this reconstructed birth with the registered birth. So according to this reconstruction, we would conclude that in Myanmar, the registered birth in the vital registration system is incomplete. Another example or another method would be to compare the registered birth with the information that are collected or reported during a census. The advantage of this method is that it covers in theory, it should cover all the population of one country. So we can also disaggregate the result to subnational, local, or even lower level. A major limitation is the census is conducted, or it's recommended to conduct the census once per decade. And there are some, as you all know, some risk that some population groups are not included. And in terms of the reporting of births, oftentimes we we get poor results because we have some proxy respondent, or some people, there is recall bias and confusion also regarding the time frame of the reference period. Here's a quick example for Vietnam. The births that are drawn from the 1999 census and the 2009 census compared to the births that are registered in the vital system in Vietnam. Another very powerful method is the method that are based on population count by age and sex. Those are some techniques are the own children method, the reverse survival, or the child-woman ratio. The idea is that the children that we observe in one population today, they indeed they are the product of births that occur in the past. And if we account for mortality and we survive this birth in the past, then we can derive the number of births in the past. So it's simple. We just need a population count. We need some assumption on mortality. And if we draw this population count from a census, we can also go to disaggregate this data for different population group. A major limitation is that the method or the results are affected by data quality. Very often we have underreporting of children or age heaping, and this affects the result of the method. And in case where we have a migration, and especially at lower level, the migration becomes more and more important. So this also affects the result. And again, there are always some group that can be not included in the data. So this is a quick example from Mongolia. based on the census of 79, 89, 2000, and 2010. The orange series you have here is the reconstructed birth, and the blue one is the registered births that are the registered birth, sorry. So you can see a very close, based on the census, we can almost reproduce very closely the registered births. Here in some years, in the past, the registration was incomplete, but in the recent year, it seems to be complete. This is the similar method result, sorry, but for Kyrgyzstan by ethnic group. And this is the number of children per woman. And you can see you can also derive some result by ethnic group. You can imagine also different group that could be put in such computation. And finally, here for the reverse survival, we have the use of education data. So based on the school records, we can also derive birth in the past. A limitation when working with education data is that there is a time lag, because usually children go to school at age 6 or around 5, 6, or 7, depending on the country. So there's a time lag between between the time when we have the data and the time when we can compute the birth. This is an example for Thailand. And you see the orange is almost overlapping the blue, the registered birth, suggesting that the VR in Thailand is complete. A last example of a very simple method to assess the quality and the coverage of the birth registration is a comparison with immunization record. So the immunization record can provide a lower bound estimate to assess the birth registration. This is an example from Myanmar. And based on this, you can see the registered birth is systematically lower than the DP3, which is the threshold that recommended every kid should have in the first year of life. And there is a limited time lag. So in theory, we can have some up-to-date data. And there is also a potential to have this data for disaggregated level. So, sorry, finally, to go back to the theme of the session. So assessing inequality in birth registration to make sure everyone is counted and is in the picture is possible. There are some very simple methods that exist to evaluate both the coverage and completeness. But as we all know, we need some data. And there is a need to keep investing in data collection system, because the more independent estimates and the more data source we have, the more we can derive some consistent estimate and make sure we measure what we want and everybody is included. Thank you.
Thank you. Thanks very much, Thomas. And thank you for that reminder that without data, even the best methods aren't going to be all that great. Our next presentation is going to be by Tom Moultrie, who is Professor of Demography at the University of Cape Town, based in South Africa. He's also one of the authors of the guide Tools for Demographic Estimation, which is available for free online, and it's a fantastic resource. So we've added just put the link to this in the chat. His particular experience with birth estimation in South Africa has a lot of relevance for many countries in our region too, as a lot of the issues, many of the issues with delayed as well as incomplete registration are the same. So Tom, over to you.
Thank you very much, Petra, and good afternoon to Bangkok and good night to New York, and good evening to those in Australia. It's very early in the morning for me here. Today I'm talking about a region which is not in within ESCAP. I'm talking about South Africa, but many of the issues we faced here are also relevant to the issues faced in the ESCAP region. And I'm going to be talking about how to estimate completeness of birth registration in South Africa over the last 10 years. Now, as background, like many developing countries, our birth registration system in South Africa is subject firstly to extensive delay and is also quite strongly incomplete. And so in such circumstances, the question arises, how does one estimate the completeness of birth registration using data from a number of sources? The causes and effects of that delayed registration, as Thomas Sporenberg just mentioned, often registration of a birth might only occur when a child needs to go to school and they need to show proof of birth. And so we have a heaping of birth registration around about age 5 as children get ready to go to school at age 6. And the problem with that is that certainly in South Africa, children who die before they are registered are not retrospectively entered as births. So someone who's only registered at 5, if they delayed registration at age 5, they don't come through the system as entered as a birth, even if their death is reported subsequently. Now, there have been extensive efforts made by our national government to reduce that late registration, but the effects of late registration are still very evident in our official annual releases of birth registration data. So this is data from South Africa. Going down in that down the rows is the year of birth, so children born in 2011 through to 2019, and going across here is a series showing was the child registered 0 years after their birth year. So that 911,353,000 would be children who were born in 2011 who were registered in 2011. There were 74,000 children born in 2011 who were registered in 2012. Now, not all of those children who of the 74,000 children registered apparently a year late are necessarily late registrations of births. A child born at the end of December of 2011 could probably only be registered in early 2012. But our data doesn't allow us accurate determination as to what proportion of those were actually 2011 births and what proportion were births which were registered actually more than a month late. The problem, of course, is that we can see that there is, in 2011, about 88% of them were registered in the year of birth, and 5% of births were registered 2 or more calendar years later. And we can start seeing, that there is this kind of heaping of birth registration around age 4 or 5 as children start to coming through school. So the question then is saying, if we're looking at the birth registrations in 2019, which is 954,000 so far, we know that there are going to be births which will have occurred in 2019, which are only going to come through in 2021, 2022, and so on. And so the question is, how do we adjust for that late registration of birth? And what we're going to be using here is a method which is called the chain ladder method or a runoff triangle method to estimate the ultimate completeness of birth. So this is the total number of births which will have occurred by the time we think all the births which will be registered have actually been registered. The method is very commonly used in insurance applications for insuring incurred but not reported claims. The analogy to birth registration is very clear. We've got incurred but not reported births. And really the method just makes one fundamental assumption. It's a relatively strong assumption that there's no differential change in the timing of reporting of deaths or births over time. So we need to make sure that there hasn't been a discontinuity in that timing of births. And what that probably means, the method should not be applied over too long a time period. It should only be applied over, say, a period of 8 or 9, 10 years. If you're interested in reading up a good primer on the method, it's this link over here on the screen. Hopefully the slides will be shared so you can click through on it. It has a worked example and you can see how it works. The end result of the application of the method after you've done this is that you can see in the green figures over here, we have managed to retrofill or future fill the number of births which we estimate to have occurred in 2019. Remember, we said it was originally 954,000. Once we've applied the method, we've added 30,000 or 3% more births to those records. We've got 984,000 births which occurred in 2019. And that will allow us then to assess in more or less real time the completeness of the overall birth registration data. But now, as Thomas Sporenberg said, that's all very well once we've got our vital registration sorted out and estimates of the number of births. Now we need to compare those that estimated number of births against a variety of different sources. And so we can take estimates from a point source. We can take estimates for the calendar year 2015, where we take estimates of the fertility, which we derive from a community survey, which is about a 2% national census in South Africa, which was conducted early in 2016. And we can estimate the number of births which that data series implies for 2015. And we can apply those fertility estimates to the community survey population. We can also apply those same estimates of fertility, which you derive using indirect methods, to the Stats South Africa media population estimates for 2015. We can use reverse survival estimates from the community survey using the WPP estimates of fertility and mortality. And then we can directly extract the births from 2011 to 2019 from a variety of sources, from the UN WPP, which Thomas produces, from the Stats South Africa Media Estimates, their 2020 edition, which has the retrospective series of births, as well as our own academic model of the population of South Africa, which has also been updated through to 2020, which has historical numbers of births. And what we get in terms of our results is that we find that our estimate of completeness of birth registration is shown by these various lines. So the blue line here is the estimate from the reverse survival of the community survey, the yellow line from the World Population Prospects, the red line from the Stats Café Media estimates, and the green line from the Tembisa model. And we've got those 2-point estimates from the 2015 community survey of the births in the last year. And what we come up with is that there's actually fairly strong consistency in the estimates of completeness, about 87% between 2011 and 2014 of those 3 series, a fairly rapid drop to about 77% in 2016, which might be data error in terms of the reporting of the vital registration system. There seems to have been a gap in the vital registration system in that year, followed by a recovery. And there's a fairly narrow range of estimates of completeness from now a number of different sources, 5 different sources, for 2015 of between 81 and 88%, and would suggest that the reweighting of children in that community survey there is problematic. It seems that there were too many children reweighted into the data, which has pushed the estimate of completeness down relative to those other sources. But what this allows us to then do is actually look at those results and actually come up with a view as to how completeness of birth registration has changed in South Africa over time, allowing for delayed registration and the incompleteness of the data. So even with delayed registration, it's possible to derive plausible, credible estimates of ultimate completeness of birth registration in a developing country. As Thomas suggested, we can further triangulate parts of those estimates. We can take school enrollment at age 6, the first year of compulsory schooling, adjust that for mortality, the survival of those children over various years. We can look at vaccination records, again, adjusted for mortality. And when one pulls all those together, one ends up with able to derive a fairly robust estimate of a completeness over time up to the current date. So thank you very much, Petra, for your time, and I look forward to engagement. If people have questions, they can put them in the chat, and I'll do my best to answer them shortly. Thank you. Thanks
very much, Tom. I think South Africa is a good example because a lot of countries in our region also have pretty good birth registration, but not quite universal. And there's still some people who are being left out. And then, as you describe, issues with also delayed registration as well. So thank you for sharing that example. Finally, our last presenter on birth estimation is Fang-Ching Chow, who is a postdoctoral fellow in the biostatistics group at the King Abdullah University of Science and Technology in Saudi Arabia. She's going to present on an exciting and developing area of statistics for demographic estimation and modeling, which is using Bayesian approaches. Please go ahead.
Thanks, Petra, for the nice introduction. Hi, everyone. Today, I'm very glad to share with you my experience with Bayesian hierarchical model for age-specific fertility rate estimation. So some background and context. So the project is about age-specific fertility rate ASFR estimation, and the aim is to estimate the ASFR for all countries since 1950 for 5-year age groups from age of 10 to 54. And the main method we use is Bayesian hierarchical model, and we also use the R package in LA to produce the Bayesian results. So this is a collaboration between the UN Population Division, UNPD, and COUST. So the main objective and motivation for our project is to develop a reproducible statistical model to produce ASFR estimates and uncertainty. So why is this important? Because especially for countries with incomplete birth registration, statistical model is quite essential in order to help to produce small, robust estimates. Okay, so the first advantage of the Bayesian hierarchical model BHM setting is that it allows a share of information across data-rich and data-poor countries. So when I say data-rich, it means the country with either a very high quality of VR data or has a very full coverage of the data across all the observation period. And data-poor country, I mean, the data available in this country is either with large uncertainty or with very limited number of observations within the observation period. So the second advantage for the BHM setting is that for countries with multiple data sources, such as surveys and censuses, the BHM is able to make use of all the available data sources with different levels and trends and account for the uncertainties across all these data sources and synthesize and get out, produce reliable estimates. The limitation for the BHM approach, which is inevitable, is that especially for countries with no or limited data, the results are subject to model assumptions. So which means that the model structure and assumption we make have to be sensible for these countries. All right, so before we fit the models, ASFR observation are adjusted for 2 steps. The first step is the completeness for birth reporting, and this information is available for all the country years and provided by the UNPD. And the second step of the adjustment is to adjust the biases of this observation by using the WPP 2019 ASFR estimates as a reference level. And for this step, we follow the method used by Liu and Raffray in their 2020 paper. So for these 2 steps, I will show you some example plots later on. So in our model, we include some external covariates to further help to estimate the ASFR. The first covariate is a total fertility rate, TFR, which is from the WPP 2019. And the second covariate is a percentage of educated female population, which is taken from the GBD 2019 study. Okay, so some examples. So here I show you the observed ASFR data for Thailand ASFR for the age group 15 to 19. So here I show you the first step of the adjustment before model fitting is to adjust the completeness of birth reporting only for the VR data. So here, so first of all, so the data series, different data series are differentiated by colors, and the different data processing method or data collection method is differentiated by the style of the dots. Okay, so all these black hollow dots are the VR data series from Thailand. So here the red arrows shows the upward adjustment for the completeness of birth reporting, and these values down here, which shows the completeness of birth reporting for Thailand over time. So you can see that back in 1950, the completeness of birth reporting, according to the UNPD, it is only around 60%. and then it slowly to increase, and all the way since the mid of 2000, the completeness of birth reporting in Thailand become very good and almost close to 100% here. So the adjustment, the upward adjustment for the completeness for VR data becomes smaller over time. So this is the first step of the upward adjustment for VR data only. And the second step of adjustment is the biases against the WPP estimates for all the observations. But here still, the major adjustment is still in the VR data series for Thailand, especially in the early period. So here the rationale is we use the WPP estimates as a baseline level because we assume that there's no systematic biases in the WPP estimates. So in general, we adjust all the observed data based on their data collection method and data type. And then generally we pull the observed ASFR towards the WPP estimates to produce a more sensible result. Okay, so after these two steps of adjustment of the data, we fit into our Bayesian hierarchical model. And here is the model results. The red curve shows the median estimates of the Bayesian model, and the red shades refers to the 95% uncertainty interval of the Bayesian model. So basically, for the case of Thailand, the Bayesian model estimates is mainly following the adjusted VR data. Okay, so just to sum up, so first we adjust the VR data for completeness of birth reporting, and second, we further adjust for all the data biases based on the data collection method and data type, using WPP estimates as reference level. And the Bayesian model with hierarchical structure can help to estimate in countries with limited high quality VR data. That is all. Thank you very much for your time.
Thank you very much, Fang Ching. I mean, I think that Bayesian modeling, I haven't really seen it implemented much at the national level in official statistics in certain of the countries in which we're working, but this definitely seems to be potential, and I look forward to discussing this further in the EGM. I'd now like to invite Sharina Tsiklari, who is head of the Population Census and Demographic Statistics Department at the National Statistics Office of Georgia, to share her thoughts and reflections on the presentations in part one.
Thank you, Petra. Hello, good morning for Tbilisi. Thank you very much for the speakers. It was very excellent session and I really enjoyed it. What we learned, the indirect estimation methods have been developed to facilitate the measurement of demographic process in countries with lacking accurate administrative data sources. One of the main indicators for calculations in registration completeness is the completeness rate, which is calculated by dividing registered births by an estimated figures. Data sources for the estimation should be high quality for NSOs, especially to obtain the reliable data. In case of Georgia, in our case, the main source for calculation of completeness rate of births is the UN World Population Prospects data. In our case, the birth completeness rates for the period for 2015 to 2019 was quite high. It was equal to 98% in average. The advantage of the World Population Prospect data is that it is available for long time series, as well as it is made according with international standards, and as we see from Thomas' presentation, also with very high quality mathematical methods. So it is which allows us to have our completeness rates international comparable as well as trustable. However, this data also has its limitations. Yeah, one of the limitations is that in general it is available on the country level, so it does not allow us to make any assessment at the subnational level, if any. So for the subnational level, is alternative sources like immunization records of infants as well as school records. But in our case, several years ago, we used also some mixed records, some survey records, and reproductive health survey records. The limitation of the surveys is that it's timeless, so it is not conducted each year, as well as the sample size. So the sample size should be big enough to characterize the fertility level at the subnational level, in our case, like at the regional level and municipality level, which is almost impossible. During the calculations, the completeness rate, one important issue is the coverage. So with both data should be covered the same category of the population. What I mean, when we are talking about this Georgian case, the UN data is covers the population from occupied territories as well in our case, but the official figure cannot capture it. So when we are analyzing and calculating the completeness rate, we should think on this limitation. The other countries may have other challenges in this regard. For example, CRVS system for some countries might not include the non-citizens' births or non-citizens' deaths. So when we are calculating the completeness rate, we should be sure, we must be sure that these both registered figures and the estimated figures cover the same categories of the population. Once again, thank you so much for excellent presentations, speakers, and back to you, Petra. Thank you.
Thank you so much, Lorena, for those reflections from the perspective of National Statistics Office. Our next session is going to look at death registration, and we're going to begin with Ramesh Silva, who is a senior technical specialist at UNFPA, and he's also another New Yorker who's very generously staying up to the middle of the night to present and participate. So we definitely are very appreciative of that. So while every country may have different populations that they wish to look at for inequalities, gender disparities are a universal category in every country we would want to know the differentials on. And Ramesh is going to present on work assessing those differentials in a variety of countries. We're going to run this from our side. So Ramesh, you just tell us when you want to move to the next slide. Eileen, would you be able to put it up?
Great, thanks a lot, Petra. I think we have the title slide, although the bottom of the slide isn't actually showing. So
I don't see it actually on my side, so maybe it's going slowly.
Yeah, I think you have to zoom out a little bit because, yeah. That's better. Great. Okay, great. Well, let's get started. Thanks so much to ESCAP for hosting us. It's great to be here with, to be part of this initiative. I wanted to present a little bit on some ongoing work that we're doing at UNFPA through the Converge initiative, Connecting Vital Events Registration and Gender Equality. This is a joint initiative with the IDRC, Center of Excellence for CRVS Systems in Canada. And although I'm going to focus quite, exclusively on death registration, I wanted to just sort of, emphasize a little bit that, our Converge initiative really does take a life course approach to this kind of work, looking, at birth, marriage, divorce, and death registration. So really spanning the life course. There's three sort of technical areas where we're working on. Today I'll really hone in and speak quite a bit about completeness and quality assessment, specifically of death registration data. But I wanted to also allude briefly in a few places about two other complementary areas that we work on. One is the use of qualitative social norms field research to understand the proximate determinants of underregistration. So this is really, really important. The completeness and quality assessment work tells us, it gives us some diagnostic sense of how big the problem of incompleteness is, and who's being left out by certain covariates or socio-demographic characteristics. Whereas this proximate determinants work really, tries to unpack, what are the causal or the main drivers behind exclusion. And then the last piece that we work on a lot is, using incomplete civil registration data for the production of vital statistics. So maybe we'll move to the next slide, thanks. Great. So I wanted to share, some results from recent work, particularly in Arab states and Latin America. And here you can see, in a number of countries that we're working in, we basically have, a sex differential in death registration. It's quite pronounced in Morocco, and when we look into that further, we see that it's largely a rural phenomenon in Morocco, and one could be misled to think that sex, the exclusion of females in Ecuador, for example, is a fairly small problem, and at the national level, it's about a 3 percentage point difference that we're estimating there. But let's go to the next slide and unpack that a little bit further subnationally. But before we do that, let me emphasize that the kind of methods that we're using here are the death distribution indirect methods, which really are very, very well documented in the IUSSP UNFPA handbook on the tools for demographic estimation, which Petra mentioned earlier. One thing to note is that these methods have a number of fairly strong assumptions that the coverage of each census is the same across age, and then the completeness of reporting of deaths is consistent across ages above, usually around the age 15 or so. And then they make some also strong assumptions around migration, or at least they demand quite a lot of data requirements to adjust for migration, although they do advance quite a bit further on the one census methods and don't have the sort of strong assumptions about population stability. But let's jump forward to what things look like subnationally in Ecuador, just remembering these underlying assumptions. If we remember, as you can see from the blue and orange vertical dotted lines on the page, the completeness of female death registration in Ecuador is about 65% on average nationally and 68% nationally for males. But when we unpack this across just the admin 1 regions of Ecuador, we see massive heterogeneity. As you can see, death registration completeness varies from slightly above 80% in some areas of the country to around 25% or so in Galapagos, for example. And then secondly, what you can see from this graph is that, almost universally, aside from 3 or 4 of these provincial regions, we see that the blue dots are to the right of the orange dots, meaning that there's that female deaths are underregistered at higher rates than male deaths. And then secondly, that you can see that the magnitude in terms of the sex differential varies quite a bit from region to region. In some areas, it's of the order of 15–20%, whereas in others, it's relatively small. Next slide, thanks. And so one thing to remember about this is that we worry a lot about this because it has huge implications about our ability to use death registration data for principled decision making. I wanted to come back to some of the real challenges here with regard to the underlying assumptions of these methods. What I'm showing you here on the left-hand, the two left-hand graphs, is some diagnostic plots from one of the regions Azuay for females and males, and then on the right-hand side, a second region, Bolivar. On the x-axis, on the y-axis, what I'm showing you is what the estimated death registration completeness looks like. So the black horizontal lines is showing you what the point estimate for this specific region for females on the left, males on the right look like. What the colored dots is showing you with the x-axis is, how the actual completeness estimates vary a bit based on your choice of the lower limit of the age range. So if we choose 15 versus 20 versus right up through to 35, and then the different colors are showing us, how things vary in terms of the upper limit of the age range, and we're choosing between upper limits of age 50 to 75. And what we'd like to see is an array of dots which are essentially horizontal across the page. But what you can see is that quite a bit of sensitivity there and variability in terms of how we choose these age ranges and the resulting estimate of completeness. So I wanted to emphasize a little bit that there's some real challenges here in terms of calibration of these methods. Next slide. If we could go to next, thank you, great. And so one of the things that I really wanted to emphasize in today's presentation was the importance of extremely simple demographic data quality assessment techniques. Here on the left-hand side, I'm just showing you data from Morocco now. I'm just showing you, if we look at the annual deaths, in the intercensal period for our work in Morocco, and we look at the age ratio, we basically look at the magnitude of 5-year age groups relative to the two neighboring 5-year age groups in terms of registered deaths. And we plot that. You can see a whole bunch of dotted lines, and then you see a blue solid line and a green solid line, which are showing you the median across the intercensal periods. And we can see, where the quality of the age reporting, of the death register year by year, where there are some years, what we really would expect to see is, small perturbations around 1.0, an age ratio of 1.0 for most of the ages. But we can see, some substantial differences there. And then on the right-hand side, I'm showing the sex ratio across the age groups, where, defined by males per 100 females, and we see, some significant distortions as we get into the later age groups. In the interest of time, let me kind of quickly go to the next slide and say that, this kind of work really does require separate assessments of death registration when we're thinking about child deaths. Here, what I'm showing you is what things look like in Guatemala. On the left-hand side, this is for children aged 0 to 5, and on the right, older children aged 5 to 14. The coloured dots on the bottom are showing you what the annual death register, what the death rate looks like, the age-specific death rate looks like, compiled from the death register. And then you can see the coloured dots higher up is showing you what the estimates look like from household surveys, and then the blue fitted line is showing you a model-based estimate by the Interagency Group for Mortality Estimation of the UN. And so here you can see, again, they're using very, very simple methods of, estimating the age-specific mortality rates, that we get a sense of how incomplete the death register is. And I really wanted to show this particularly to show a big contrast between the precision and the clarity that we can get here versus what we get from indirect death distribution methods for adults, where we're assuming that uniformity across the age range, whereas here we can explicitly see that things look quite different across the age range for children. Next slide, thanks. I wanted to emphasize some complementary work that we're doing alongside of these completeness assessments using indirect methods. We're not only interested in, civil registration for the purpose of vital statistics, but as Petra has nicely said from the get-go, we worry a lot about inclusiveness and visibility from birth right through to death. And what this diagram is showing you is joint work with the Center of Excellence on some of the social norms field research that we've been doing to unpack different layers of the problem in terms of what drives exclusion, at the individual level versus how certain household dynamics and broader cultural and socio-political factors. And this work uses a lot of focus groups, in-depth interviews across different communities to really unpack what drives some of these differentials, particularly by sex, so that we can interrogate the indirect estimates alongside of this qualitative information. So we'll just go to the next slide, and to conclude very quickly, to say that our work has really emphasized the need for sex disaggregation, and that sounds obvious, but it's actually in the literature. You'll see, and even from the official publications of the United Nations, death registration completeness is actually rarely published in a sex disaggregated manner. Secondly, one needs to pay attention a lot to the notable variation across regions. And but that becomes quite challenging, especially in terms of adjustment for internal migration. We've found that really basic demographic data quality assessment techniques help a lot to better understand the quality of your data. However, one should not assume that indirect death distribution methods on adult mortality give us a good understanding of what the situation looks like for children. And then lastly, just to conclude, this work on understanding the determinants of under-registration through qualitative methods is something that we're finding to be enormously insightful alongside of these indirect methods. Thank you.
Thank you very much, Ramesh. We'll move to the next speaker, and I'd like to invite Tim Adair, Principal Research Fellow from the University of Melbourne, who's going to present on the empirical completeness method. So Tim, you have the floor.
Thank you, Petra. Yes, so I'm from the University of Melbourne and working with the Bloomberg Philanthropies Data for Health initiative. And I'll be presenting to you today about the empirical completeness method, a method for estimating completeness of death registration. So I'll jump straight into the method. This method estimates completeness of death registration or any mortality data source at the national level, but also for subnational populations, which is obviously important for inequality assessment. And importantly, the method uses a fairly limited set of data inputs to estimate completeness. And these inputs are readily available not only at the national, but also subnational level. The first one is what we call the registered crew death rate. So this is your registered deaths divided by the population multiplied by 1,000. So like a normal crew death rate, but based on with the numerator of the registered deaths. An estimate of the true under 5 mortality rate, which is a way of representing the overall level of mortality in the population. The percentage of the population aged 65 and above, which is a proxy for population age structure. And then the completeness of death registration at ages less than 5 years. And we have one version of the model which includes this variable and another which doesn't include it. So I guess the rationale for including these variables, if you just look at this equation here, completeness is really registered deaths divided by estimated total deaths, and it's put another way is the registered crew death rate divided by the true crew death rate. And so that then becomes the registered crew death rate divided by really what you could describe as the population age structure and the mortality level. So those two those two factors combined determine the true crew death rate. And so we, in our model, we represent each of those factors which are predictive of completeness. We developed the method based on almost 2,500 country years from 110 countries in the Global Burden of Disease database, and developed models for both sexes and also males and females. So it enables a gender inequality analysis as well. So in terms of advantages and disadvantages of the method, it's relatively practical and straightforward to apply. So that really helps a wide range of users to be able to apply the method, and we've trained a number of users in many different countries, including in the ESCAP region, to use the method. The method itself is relatively reliable, so it's based on our analysis. The predicted completeness is on average within around 5 percentage points of observed completeness. And importantly, it's not really subject to those really strict assumptions of population dynamics of the death distribution methods, particularly at the subnational level, where it is challenging to apply death distribution methods, as Ramesh touched on, because of the assumption of either no or minimal migration. And so its utility in estimating subnational completeness is particularly useful for assessing inequalities, and I'll touch on that a bit later. Another thing also that's important is that it gives you timely estimates. Death distribution methods, particularly generalized growth balance and synthetic extinct generations method, they're intercensal methods. And so if the last census was in 2010 and the census before that was in 2000, then it's estimating completeness for an intercensal period, which is over 10 years ago, even 15 years ago, I guess. So the empirical completeness method actually enables you to estimate completeness for the most recent year of data. So that's particularly useful to provide those timely estimates of completeness. In terms of probably the main disadvantage is that we use the under 5 mortality rate as a proxy for the overall level of mortality in the population. Now, in a setting where adult mortality is particularly high relative to under 5 mortality, a classic example is places with high levels of HIV/AIDS mortality, or places with significant mortality shocks, for example. In such settings, then the estimated completeness may be biased because of the under 5 mortality rate isn't really summarising the level of mortality well. So in terms of assumptions and requirements of the method, as I said, the data required are fairly limited, which makes it particularly useful. So you need the number of registered deaths that are annualised, preferably based on year of occurrence if possible, not year of registration, and also disaggregated by age, but that's only needed for under 5 completeness. For under 5 years of age, if using under 5 completeness as a data input. You need an estimate of under 5 mortality rate, and that can come from, or subnationally can come from a census or demographic and health survey or mix, and obviously nationally there's IGME and GBD and estimates, and population by age. So fairly limited data inputs. Then you use the model coefficients and random effects, and this on the right here you can see this is an Excel template, fairly straightforward to use. Just input the data in the pink cells there, and the green cells down the bottom predict the completeness, both sexes, males and females. And as I said, there are two models, one which includes the under 5 completeness and one which doesn't. In some settings, under 5 completeness is not a particularly good predictor of overall completeness. And so it may not be useful to use. And just to reiterate, sorry, that this predicts completeness at all ages, okay? So yeah, completeness across all ages. So that's sort of that it makes it a fairly simple outcome, I guess, that it's predicting. It's also included in the Anaconda data quality assessment tool some of you may be familiar with. In terms of its applicability, as I said, there are models to estimate completeness for males and females, and it's been used to estimate subnational completeness by local analysts in numerous countries. China, Myanmar, Bangladesh, Nepal, Philippines in the ESCAP region. As an example, we co-wrote a paper with some Chinese colleagues which applied the method to estimate death registration completeness in over 2,800 Chinese counties. And you can see here, the granularity of the results, that you've got sort of in the western part of the country, more remote areas, quite low levels of completeness, under 30% in some counties, and then on the coastal areas, in Beijing and Shanghai, etc., completeness of up close to 100%. So what we did in that paper was we were able to look at the correlation between education and income per capita at the county level with the level of completeness. So not a direct measure of inequalities, but certainly an area level analysis, which is quite powerful, especially when you've got 2,800 or so data points. And also, you could potentially use the method to estimate individual level inequalities in completeness, but that obviously requires a disaggregation of data inputs. So, for example, if you're looking at inequalities by education, you would need your under 5 mortality rate and population, etc., disaggregated by education. In terms of improving the model, there's a lot of investments in death registration or civil registration systems at the moment. So more and more country user data we get, we're hoping to add to the database to develop the models, including countries at lower levels of completeness. And also we're looking at including socioeconomic predictors as well. So the paper it's based on is just listed there, and a summary of the method as well. And you can also email me if you have further questions about the method. So thank you.
Thank you very much, Tim. And hopefully we'll be able to build on that, on this method when we develop the guidance further. Finally, we have Stefan Hellinger, who is a professor of social research and public policy at NYU in Abu Dhabi. And he's conducted research in sub-Saharan Africa and South Asia on improving data on adult mortality, with a focus on differentials by location and education for subnational populations. So Stefan, over to you. You see you've got the document. You're sharing your screen.
Are you able to see?
Yeah, it's just disappeared. I think it's behind it's behind. Yeah, there it is. But it's not full screen. It keeps on coming into the Teams. That's it. Are you able to make that full screen? Great. Thanks, Stefan. Stefan, you're on mute. Stefan is still on mute. Stefan, we can't hear you. And I can see that you're on mute. Stefan?
I'm very sorry about this.
Okay. We could see the presentation, but you were muted, so we couldn't hear you.
No. Can you hear me?
Yeah, it's kind of going a bit in and out. Okay.
You still can't hear me?
No, I can hear you now, but it was cutting off a bit, but now it's fine.
Okay, so I'm very sorry. So comparing registered deaths and to estimated or expected total number of deaths is an important strategy to assess the completeness of a registration system, as was just discussed. And so in a low and lower middle income country, these estimated total of deaths are often derived from model or cross-country estimates, such as the Global Burden of Disease study or the World Population Prospect. And so the primary data inputs in those model estimates are often census and survey data on mortality. And so based on these survey data and census data on mortality, what do we know about disparities? Well, we have some information, in particular about mortality rates by gender and age, against which we can potentially assess the completeness of death registration. And censuses also allow calculating death rates by some socioeconomic characteristics, including wealth quintile and geographic area, for example. But they have these data sets have limitations. So censuses, for example, occur every 10 years at best. Surveys are more frequent. They occur every 3 to 5 years. However, they collect data from reports of relative survival by asking questions about children, siblings, parents. And so we don't know the socioeconomic characteristics or the residence of these relatives. We only know the respondents' socioeconomic characteristics or their residence. In addition, in survey data, we have more or longer data series on child mortality estimates, and adult mortality is a bit of a difficult area to study. So where does that leave us in terms of assessing disparities in mortality and using this as a benchmark against which we can assess the completeness of death registration? Well, often what we do is we derive adult estimates of mortality and by extension completeness from data on child survival and then using a model life table. Or what we do also is we use respondents' data in surveys or in censuses as a proxy of their relative socioeconomic characteristics. So what I'm going to try and see is if we can get a better picture of some of the socioeconomic disparities in mortality from survey data, so that we can then later use it to assess the completeness of death registration by socioeconomic group or by level of disparity. So our study is part of a multi-country study on the measurement of adult mortality that was funded by the US National Institutes of Health with sites in Senegal, Malawi, Bangladesh, Guinea-Bissau, and Uganda, and in collaboration with a number of institutes, including ICDDRB in Bangladesh. And so our primary goal was to validate the survey data we collect on mortality to see its reliability and validity, but then we also wanted to see whether we could collect additional survey data on mortality disparities among adolescents and adults, so we can know those disparities better, but also allow finer measurement of disparities in the completeness of death registration. And so we focus specifically on residents, so try to see if we could get subnational estimates, and on the educational level of disparities, because it's a simple marker of SES in the sense that it's simpler to measure in surveys of censuses. So we collected data. So I'll talk briefly about what we did in Malawi, for example. We had more than 3,000 respondents, and we tested additions of survey questions regarding residence, education, HIV status of relatives. We found that we were able to assess the residence of the siblings, so a potential way to measure disparities by geographic area. In Bangladesh, we collected data on more than 2,000 respondents from the MATLAB Health and Demographic Surveillance System, and we tested the addition of survey questions regarding education in questionnaires about the survival of relatives, and we also added direct questions about death registration. And so these questions we added to the survey are very simple. So we asked each respondent to tell us the highest level of schooling of their sibling, as well as the years of schooling that completed at that level. So it matches the question that are asked about respondents in DHS and other surveys, for example. And so what did we find here? Well, we find that respondents in surveys are able to report this, including about their deceased siblings, and that it takes very limited time to collect. So on average, it takes about a minute to collect mortality data on age and gender for each relative. Adding questions about education takes 15 to 20 additional seconds. So it's well feasible to do in surveys. And what we found when we compared the level of education of the respondents to the level of education of their siblings is that there are more limited concordance than we expect. So here you have this on the right figure here, where you see that respondents with no schooling, for example, have quite a few number of siblings that have higher or much higher level of education. So the problem we have, if we use the educational level of the respondent as a proxy for education and to measure disparities in education, is that we will have what is called attenuation bias. So we have results that will hide disparities in mortality. And we tested that with data from Bangladesh by looking at survival probabilities over the past 15 years at adult ages. And here you have results from a Cox regression model, so survival analysis, where we look at differences in mortality according to the respondent's own education. And we see basically no differences, no disparities within the population. Whereas on the other hand, now if we bring reports about the siblings' education, we find very strong gradient in mortality by educational level. So we would get a very different picture of inequality by education that will matter for our assessment of completeness of death registration. So what I wanted to show you with this short presentation is simply that surveys are an important source of information in the process of assessing completeness of death registration, because we can conduct them more frequently than censuses, and potentially even more frequently now with all the investments in surveys via cell phone, and they allow assessing some level of disparity in mortality within the population. They have limitations nonetheless. One key concern is sample size. Adult mortality is a rare event, so measuring disparities is demanding. But there might be an opportunity here because the need for larger surveys to assess excess mortality linked to COVID-19, for example. So that might be a time to conduct these assessments. And we would also need to make sure that we collect some of these SES data on the deceased during death registration to be able to use those data as benchmarks. And I will stop here.
Thank you very much, Stefan. This concludes the presentations on mortality. I'd like to invite our discussant, Nasrul Wajdi, who is a statistician and researcher at Statistics Indonesia, to share his thoughts and reflections on these presentations.
Can you see my slide, Petra?
Yes.
Okay, thanks, Petra, for the time and introduction. Hello, everyone. It's such a great opportunity for me to learn lots of new knowledge from experts today. Three presenters presented various methods for measuring completeness and coverage of death registrations that potentially could be applied in particular for low capacity countries. It is with great pleasure for me to share some of my opinions regarding today's topics, especially in the view of the National Statistics Office. The work of an NSO is following the UNFPOS, the United Nations Fundamental Principle of Official Statistics. I found that at least 4 principles that are relevant with today's topics, namely Principle 2, Principle 3, Principle 5, and Principle 9. It is a long tradition that statisticians, together with academia, scientists, and professionals, working together on developing a certain method for producing official statistics. We know that in 1950s, the United Nations worked on the systematic collections of population and methods of analysis and published them in the form of the UN manual. Related to Principle 5, it is acknowledged that one source of official statistics is registration or administrative data. The use of administrative data, in particular civil registration data for developing official statistics, is also a long tradition. The UN published a UN manual series F number 7 in the 1950s titled Handbook of Vital Statistic Method. 3 points caught my attention with the current topic. On the first page of the book, it is highlighted the importance of presenting uniform concepts, definitions, and procedures. Furthermore, on page 110, the book emphasizes the importance of completeness and accuracy, so that if the data are complete and accurate, they will be served as valid and reliable official statistics. Therefore, the completeness of data is one important aspect for developing quality statistics. So completeness matters, but we should also bear in mind that the method used should be internationally comparable. There are some works in this field that have already been published. Tim previously explained comprehensively the advantages and disadvantages of several methods, including the work of Preston and Hill, published in Population Studies in 1980, titled Estimating the Completeness of Death Registration, and also incorporated the work of Hill, published in 1987, titled Estimating Census and Death Registration Completeness. I recommend also to read the special issues recently published on population health metrics, which comprehensively reports the result of an in-depth study. Another work by Stefan is also very good as a reference, especially for those who are involved in demographic surveys. For the case of Indonesia, the work of Rao and friends, which Tim and Alan also on the team, showed that from 2006 to 2007, the data completeness in Indonesia was an issue. Their finding showed the difference in data completeness in rural versus urban area. Furthermore, learning from the result of our census shows that registration remains an issue in Indonesia. Figure 1 shows the number of the deceased person identified from the census, but they were still registered on the population database. The trend is increasing, although in 2020, the number decreased. This is in line with the fact shown in Figure 2, that around 78% of the deceased person is unregistered. Therefore, a reliable method is essential to measure the completeness and coverage of this registration. Before concluding my presentation, I would like to add several comments and questions for further discussion as follows. As proposed by Tim, it is necessary to add some contextual variables on improving the estimate. It should be taken into account that adding some contextual variables may create new issues for a certain country in terms of the availability of the variables. The Excel template explained by Tim earlier, I think is a good example of best practice in terms of operationalization of the method. How about subnational level estimates? Is there any case study, or are there any techniques that have been developed? For instance, the use of small area estimation. As pointed out by Romes, for the case of Guatemala, we saw lack of accuracy there. What about rare case event? For instance, maternal mortality. This is one indicator for SDGs. For the national level, we might get this indicator through certain household surveys. But what about subnational level estimates? And what about the standardization issue? I think ESCAP can facilitate discussion among NSOs so that there is a consensus regarding what method to be used. It is also important that once the method has been established, the capacity building on using the method should be provided. More importantly, the method should be easy to implement given the resources available in an NSO. Lastly, I think it is important to highlight the use of the measure, not only as an indicator to measure the completeness and coverage of death registration, in order to improve the quality of the registration. But also, for instance, can we use the measure as an adjustment factors for certain mortality indicators? I think the guidelines regarding the use of the measure is also important. That's all from me. Thank you for listening. Stay safe and good afternoon.
Actually, that was an excellent. Those are excellent reflections, and I think very relevant for us as we also develop the guidelines from the EGM. I'd like to thank all the participants and the panelists and discussants, especially those who've stayed up very late, who've got up very early. We'd now like to open the floor for questions or discussions. I know that there's been questions already being asked and answered in the chat, but please do add any questions. I can see that there's one which is for Stefan and hasn't been answered yet, so maybe I'll invite Stefan to respond. The question is from Syed Mohammed Husseini in Iran. And his question is, would you please explain a bit more about tested on questions re survival of relatives for Bangladesh? So Stefan, would you like to answer that question?
Yes, sure. And my apologies, I went a little bit fast on all of this. So we took the standard DHS questionnaires about the survival of siblings and parents, for example, we took this standard questionnaire and added questions about some socioeconomic characteristics of those relatives, alive or deceased, so that we could try and calculate mortality rates separately for various population groups, so as defined by their education or by their residence, for example. So that's the key modification we did relative to instruments that are very well known, survey questionnaires that are widely used throughout the world.
Okay, thank you, Stefan. And maybe I know this is being discussed in the chat, but maybe one of the panelists from the birth section would like to expand a bit more on the use of the WPP estimates in the modelling, as I think there's been questions about it being a bit circular or the biases being compounded. So Tom or Thomas or Fanching, would anyone like to take this further?
Hi, thanks for the question. So the main usage of the WPP estimate is really to help to get a sense of the biases in the observation. So the model itself is still going to capture the data trend, but here the assumption of the use of WPP estimate is to assume that it is unbiased. It is unbiased across all the data sources. So we use that as a reference level to have a better understanding of if there's any systematic biases in some data series, which in turn helps us to make a more reliable estimates. Thanks.
Thank you. Tom or Thomas, would you like to also add anything? If there's anything you'd like to add in addition to what you wrote in the chat?
The point, maybe I misunderstood the comment in the chat, but for me it was more that the WPP is internally consistent. That is, we have a population, we have a number of births, a number of deaths, and they all, from a demographic balance point of view, they all match. We can reconstruct the population using that. Sometimes in official statistics, that is not the case. So the WPP can be taken as a kind of reference or comparison, point of comparison, to have a sense if the official is above, below. Doesn't mean that WPP is the right answer. It's just that relatively to it, where the official stands, and try to understand the difference. So that was my point in the chat, but it was not related to the modeling that Feng Shui just commented. Thank you.
Great. Thanks, Thomas. And we have a question that came up also from Diego, but I can see Christophe has also asked it, and that's around the COVID-19. So Diego was asking about the impact of COVID-19 on registration, and Christophe is asking about the impact of COVID-19 on the data and the estimations for the future. Would anyone like to talk about how COVID-19 has been impacting your work?
Yeah, thanks, Petra. Tom Moultrie here. Yeah, I mean, as I responded to Diego in the chat, and I think as you responded as well, the impacts are going to be context specific as to how the epidemic has unfolded and the kind of consequences thereof. So we saw in South Africa, for example, that a number of the Department of Home Affairs, which does our civil and vital registration, were closed during various points of the national lockdown. It was a very intense lockdown, partially closed because of the lockdown, partially closed because of infections of the staff members who worked in those offices. And this has created a problem for the birth registration in the sense that birth registrations were not being prioritized, death registrations were being prioritized. And because in South Africa, a death of an unregistered birth does not get back captured as a registered birth, that has impacted both on our ability to measure excess mortality from COVID, as well as it's going to impact on the registration of births going forward. And so this is going to be something which is, I think, is going to affect completeness differentially around the world. And each country will have to contemplate how their administrative systems, the very process of going to register a birth or a death, has been impacted by COVID, particularly in terms of the basics of the data collection exercise and then the subsequent data processing. But I think there will be an impact on the quality of and the completeness of vital registration, probably globally, in every context. Thank you.
Yeah, and I can add that actually the motivator for this work was a lot of it was to do with COVID as well, and the difficulties that a lot of countries are having where they don't have universal death registration to measure, without even going into cause of death, just excess mortality. And the fact that we know that COVID has a differential impact on different populations, and those are the ones who are also often least likely to be registered. So we're going to be missing out on some of the worst effects of the pandemic in the countries which don't have universal registration, especially where there's high levels of inequality. So that was one of the reasons why we launched this project as well, this initiative. So we just have a couple of minutes remaining, and I wonder if any of the presenters would like to also add anything, given the reflections of the discussants, if there were any comments or follow-up that they'd like to make in the last remaining minutes. This is your opportunity to respond. Okay, so if not, then I think that we can, I think all that remains then is to thank all the participants for taking part in this webinar. Thank you to the panelists and to the discussants, and thank you to everyone who participated actively. We're going to be continuing the discussions in an expert group meeting, which is going to take place this Thursday. As I've mentioned, we aim to develop guidance for countries on implementing these methods to better estimate births and deaths for subnational populations. And we're developing this into a larger project of technical support and capacity strengthening for CRVS inequality assessments. And this work is a very important first step. If you're interested in participating in the EGM, but you haven't yet received an invitation, please do get in contact with us at ESCAP. We'd also request that you submit the evaluation of this webinar, the survey that's being linked to. This is very helpful for us as we're learning all the time about how to better run these kinds of events. And as mentioned previously, a recording of this webinar will be made available, as will all the presentations. And the conversation in this chat of this meeting can continue for another month or so. So please do feel free to continue to discuss and ask questions, and we'll be monitoring it as well for any follow-up. So thank you all very much, and I hope to see the discussions continue at the expert group meeting. Thank you.
Thank you all. Thank you.
Thanks.
Thank you, everyone.